By law, hospitals are required to put their prices online, but many aren't fully complying, and it's costing people money. CBS News consumer investigative correspondent Anna Werner is here with more on these hidden costs.
John, the federal law is designed for you to be able to figure out approximately how much you might pay for a procedure or why you were billed as much as you were. For many people, it's still complicated and frustrating, as one woman we spoke to found out.
Pat Simmons and her husband retired over a decade ago. They left the U.S. to save money.
High costs of everything. We were finding taxes were going up.
It sounds like just the high prices of living here in the United States.
In the United States.
Just was too much.
It was too much.
They moved to Ecuador, where she says nearly everything is cheaper. But they come back regularly to visit family in Seattle, as she was doing last May when she suddenly started feeling ill.
On the flight from Quito, I got incredibly sick. I was throwing up. I was very lightheaded. I was going to faint.
After arriving in Seattle, she went to the emergency room here at St. Anne Hospital.
They did the CAT scan, and then they did the consult. And the doctor says, he gave me a sheet of paper that said, oh, you might have colitis.
Because she lives in Ecuador, Simmons doesn't have Medicare, but she had bought a travel insurance policy from company Global, and the hospital sent the bill for the ER visit there. But some 3 months later, Global turned down her claim, saying despite her emergency that she had a pre-existing condition. And in September, the hospital bill came to her, over $16,000, with a CT scan priced at $11,000.
And I'm like, this can't be right. This cannot be right. It doesn't make any sense.
She wanted an explanation, but says she couldn't get answers from the hospital.
None. Never. Nope. And I sent several messages.
That's despite the fact that under a rule established by the federal government 3 years ago, hospital prices are supposed to be transparent. The rule requires hospitals to post pricing files with minimum and maximum prices charged for their services, as well as the cash price for patients who don't use insurance. Along with that, the rule says hospitals must display a consumer-friendly list of shoppable services or provide price estimates online. Simmons says she did a search online after she got the bill, typed in the CT scan on a price comparison website, and found the cash price for the same CT scan at that same hospital listed as much lower.
$3,500.
A cash price that was roughly a third of the $11,000 she was charged. When we went to the hospital's website ourselves and looked at the standard charge list, we got a price of over $9,000.
This isn't making sense to you, clearly.
No, none. I have this $16,000 bill that I'm not paying until I get answers.
A new report by PatientRightsAdvocate.org, or PRA, analyzed the websites of 2,000 U.S. hospitals and found only about 34% of them fully complied with every requirement of the rule.
It harms patients every single day to not know what they're going to pay in advance of their care.
Cynthia Fisher is the founder of PRA.
The truth is in the numbers. The prices are either there or they're not.
The American Hospital Association's Molly Smith says her trade association supports transparency.
Hospitals are committed to making sure that patients have all of the information that they need about their care, and that includes information about the price of the services that they are going to get.
She told us PRA's report is wrong.
Frankly, no matter how many times they say it, it's just not going to make it true.
Smith points to this 2022 assessment from the Centers for Medicare and Medicaid Services, looking at hospital compliance with the rule, that said 70% of hospitals fully met website criteria under the rule. But Fisher says,
we agree with the American Hospital Association that over 70% of the hospitals do have pricing files. It's just that most of them are incomplete. As long as hospitals and insurance companies hide their prices, they can charge whatever they want.
None of that helps Pat Simmons.
If they had told me when I went in there that it was going to cost $11,000 for a CAT scan and my bill would be $16,000, I would have gone home and taken my chances.
Simmons' bill is now $17,000. It's in collections. She says if she and her husband are forced to pay up, it will eat up virtually all their savings. Now, the travel insurer Global and the hospital system she went to, Virginia Mason Franciscan Health, told us they could not answer questions about her case due to patient privacy. The hospital system says it is committed to helping patients understand and afford their care and is looking further into her case. But it says that CMS deemed its approach with its posted pricing compliant, John.
Oof.
Yeah.
That is, so if I'm watching this, I'm, terrified about what would happen if I wanted to try and get to the bottom of my own numbers from a hospital. What can people watching do?
Well, with emergencies like her situation, it's really hard, right? You have a medical emergency. You just need to get to the emergency room. But if you have a procedure that's coming up, first of all, you can go to their websites, look for the price estimator tool, which hopefully would give you a fairly good idea. The other thing that I've done in the past is call my insurance company and ask them, look, if I go to hospital X with Dr. Y, how much will it cost? If I go to this other hospital with this other doctor, how much will it cost? And they were able to tell me that. So unfortunately, it requires consumers to do a lot of work to figure out what the price might be. And even then, you might get a surprise, some kind of a surprise in the bill, not necessarily a surprise bill. Some of those were, sort of outlawed. But you can still get a bill that you don't expect, unfortunately.
Yeah, you have to do all that work when you're probably feeling a little jittery and nervous about whatever your procedure you're going in for.
It's a lot.
Anna Werner, thanks so much.